in 2007, I was planning to go on a pilgrimage, and I had a bit of a sore throat. And I'm fortunate that I worked in a hospital, and therefore I just contacted one of the ENT consultants, said, would they have a look? Because I was a bit concerned. I'm going away to Mecca for 3 weeks, and the sore throat was not getting any better. And he said he wanted to do a biopsy. He had some concern of what he saw. We agreed that I would see him again after I come back from the pilgrimage. 3 weeks later, we did a biopsy, and it became evident there was a tumor. And the shock of hearing that was quite, as you can imagine, quite traumatic for me. And to be frank, it took about a week before I was able to tell my family. And a week later before I was able to tell my parents. Anyway, I discussed it with my consultant, the different options that we had. With a success rate of 95%, we felt confident that undergoing radiotherapy for a month would hopefully get rid of the tumor. But a year later, the tumor returned. And that was just as devastating as the first time. But in the end, having consulted with numerous physicians and colleagues, we decided that the best option for me was to go for a full laryngectomy. And that was an experience and a half in itself. Spending 3 weeks in the hospital without being able to eat or communicate. And the only form of communication was by the whiteboard and writing things down. That was very frustrating. Anyway, 3 weeks later, after the tests had been done, I was fitted with a valve, a speech valve. And I came into contact with my speech and language therapist at the time. And the remarkable thing about the valve itself is that it gives you a voice straight away. But this speech and language therapist spent a lot of time with me for me to come to terms with, to be comfortable with using the valve. One thing I must say, that I found a speech and language therapist a godsend in more than one way, more than just the physical side of improving my voice, but the psychological support that I got, because they understood what was going on inside me, not just physically, but more often psychologically, something which I couldn't even share with my family, because my family did not understand. And I suppose that the psychological trauma that I went through in those periods was quite difficult, because I just felt it uncomfortable talking to people. I just wanted to be left alone. And that's when I found that the support of the SLT, which to me were my safety net, because I knew they were there, and they were there all the time whenever I wanted. I needed to talk to somebody. They were there. So for me, the SLTs not only improved my speech, but definitely improved the quality of my life. And even now, I'm still getting regular support, because we're trying different valves to try and improve the quality of my speech now. And I think that for a service which I believe went beyond the call of duty in that respect, I just found it amazing, and I'm grateful to that. No need to take two.
That was just excellent.
Wrap it up. It's a wrap.
We have a weekly MDT, multidisciplinary team meeting, and the patients are all discussed by all members of the team, decide what treatment they're going to have. And that's when I sort of pick up the ones that I think are going to be appropriate for me to see. We always have a pre-treatment session for the patients in our area, where we see them with a clinical nurse specialist and the dietitian and talk about the implications of the treatment, and so the patient can make an informed decision on what sort of treatment they want. With patients who are faced with having a laryngectomy operation, that's having the voice box removed, we usually try and get them introduced to another patient and their family introduced to the family of another patient. This usually takes place either in the hospital or if it can happen at a patient's home, it isn't always possible. But that gives the patient an awful lot of insight into all the discussions we've had previously about different methods of communication post-surgery, and gives them much more encouragement often and makes them help them to make a decision. Our role straight after surgery is often just to assess the swallowing to see if the swallowing is safe. If it's unsafe, the liquid or food could be going down into the trachea and cause an aspiration pneumonia, which is obviously life-threatening and can hold up the patient's stay in hospital and prevent them from being able to swallow food orally, and they'll have to go on to non-oral feeding, which is usually an NG tube or a gastrostomy or jejunostomy. I think until you're faced with this sort of situation, you never actually think about how communication and swallowing are part of your quality of life. And without it, it can be disastrous for quality of life, for your social interaction, and all sorts of things. And I think it's not until patients actually are nil by mouth that they realise how difficult it is. And patients who I see on the ward who have been nil by mouth for 2 or 3 weeks, and when I give them a drop of water, I think it tastes much better than champagne.